Tell us a little bit about yourself. How did it get started and what do you do?
I went to Melbourne, completed my master's after my MD PhD. I have my own platform called the Integrated Medical Care Hospital in Lahore.
What do you think is a good number of years after which people should get worried about, getting pregnant?
So again, two categories of people. If you do not give them the good news in 1 year's time, they're pressurized socially by relatives, by their in-laws, unfortunately. That brings them to us. Second group is the one who get married. They don't want to conceive for a few years.
कोई नुकसान होता है उनको, like something that deters pregnancy later on?
आपको regularly अपना checkup कराना चाहिए. It's not people giving advice. I receive so many patients who Google. They self-induce. They grow their follicles. And they come to me without having. You do not find out the root cause. What actually is the root cause? Is it the male factor? Is it the female factor?
बहुत मुश्किल है ये awareness. Males को ये बताना या suggest भी करना.
Yes.
There could be a problem.
Wife and the husband, they both have their own secrets to share. So उनकी बात हमें अमानत रखनी.
That's how we can help them.
Yes. It's common sense कि अगर आपकी tubes खुली हैं, would only then it allow the passage of the sperm into the tube to meet the egg. So blockage है तो वो दोनों, मैं हमेशा हंसती हूँ कि ये सोनी माहीवाल वाली बात हो गई कि वो उधर रह गया,
वो उधर रह गया.
हम hormones दे रहे हैं अगर ज़रूरत है, हम और चीज़ें दे रहे हैं, but dietary restriction and weight loss is the key to regularize their menstrual cycle and so that they are able to conceive. Alhamdulillah, हमारा जो patient आता है वो convinced भी होता है, they become like a family to us, और हमारे लिए ये success है अगर उनके हाथ में baby होगा, हमें babies मिलने आते हैं.
Yeah.
Yes.
That is, I think, the most rewarding thing,
Yes.
right? Hi everybody and welcome back to another episode of Let's Talk with Sadia Salman. Today we are joined by a very special guest. She is an IVF specialist and a fertility consultant, and she has worked with a lot of clients and she's done wonders with the reproductive health of so many people. Let's say hi to Dr. Arozia Moazzam. Hi.
Hello, Assalamu alaikum.
Assalamu alaikum. How are you doing?
I'm good, thank you
I'm
so
so
much.
glad you could join us today. We've been waiting for this moment since so long.
Thank you so much for giving me this opportunity.
I know we've been talking about this, that we'll be doing this podcast and we need to spread this, awareness to people. And I think it's been a month since we've been trying to match up our schedules.
Yes.
You must be a very, very busy person. Why don't you tell us a little bit about yourself? How did it get started and what do you do exactly?
So ever since I think I was born, I was told that I was going to be a doctor. So I've been the lucky one to be a graduate from King Edward Medical University. So it was very strange because embryology or developmental biology is a subject that is usually a small subject, a super specialty. When you graduate or you're in medical school, you want to be a general gynecologist or a general surgeon or,
Yes.
general fields. Somehow or the other, embryology was always my muse, and it always struck me and had, an interest in how a human being comes into life.
Wow.
And how is a human being created. So days, months and years passed by. Reproductive medicine, reproductive endocrinology was a very emerging field, very unrecognized about 2 decades ago. Months and years went by and I started developing an interest in a very emerging and upcoming field called reproductive medicine, reproductive endocrinology and infertility. So I had the opportunity of starting a PhD in reproductive physiology and had my fellowships at Mass General, Harvard Medical School for reproductive genetics. Then I had my comprehensive training in assisted reproductive technology, which is like the training of male and female assisted reproductive, like IVF and all the male infertility lab skills at Cleveland Clinic, Ohio, United States. Then I think I was still not satisfied, and
it's strange that you're not satisfied after all these. It should be one of those things that you're like, okay, I think I'm done with this now and I need to move on.
No, so I wanted, the last nail to be hit. So I covered reproductive genetics at Harvard. I completed my male and female infertility fellowships at Cleveland Clinic. I completed my training in IVF at Cleveland Clinic, and yet something was missing. So what I thought was that Monash University, Melbourne.
Yeah.
So being an American trained, I still opted for Monash because that's the world's top ranked program in clinical embryology.
Oh, okay.
So I had always felt that if we go through the OBGYN pathway, which is the traditional pathway, I would not be able to cover the lab skills. So being a physician and then being a scientist, this quest or the thirst for seeking knowledge. So I went to Melbourne, completed my master's after my MD PhD in clinical embryology, and covered all the lab skills and the lab aspects as a clinical embryologist. So what I do now, I have my own platform called the Integrated Fertility Center and Department of Reproductive Medicine at a newly developed hospital, not so very new though, Integrated Medical Care Hospital in Lahore. So
it's actually getting very famous by the day, because it's one of my favorite places to go also, and I send all my patients there.
Yes.
I think it's a really nice setup with all the new technology, and the doctors are really nice. So yeah, I'm so glad that you're part of that hospital. Like, we already trust that place so much.
Yes. So it is predominantly King Edward alumni and predominantly American trained. So it is a hub for, I would just claim, that very unique specialties and very unique people.
That's
so
right.
as the name says, it's integration. So for instance, for myself, if I have to integrate, if I need help regarding gynae obstetrics or surgical help or urology, pathology, radiology, anything you said, we
They're
are all
all
under one
available.
roof and we integrate. So we send the patient and the patient is returned back to us safe and sound for further treatment.
That's a good thing to say for a hospital.
Yes. And I mean it actually. I mean it actually.
So doctor, tell us about a little bit about the infertility treatments that you have over there. What kind of people come to you? How do they reach you? What kind of symptoms do they have? What kind of issues are they facing? After which they realize that, okay, now we need to go see a doctor.
Yes. So what I've encountered in the last 4 years that I've been working at IMC, there are two very specific group of people. One belonging to a very humble socioeconomic background, and one that belonged to the elite class. So when I talk about the people who are from the low socioeconomic background, it is probably the ignorance. It is their hygienic conditions, their financial status, that they have been trying for conception and they have not been able to reach the exact medical personnel. When you talk about the people who are like educated, I have seen a lot of, honestly speaking, drug abuse. I have seen alcoholism. You know, they are on very different drugs. Even I had not heard about them. And very modified lifestyle, actually.
Right.
So two diverse populations. Unfortunately, this field is an expensive field. I always tell my patients. So sometimes it's heartbreaking, you know, when
not being able to help.
Not being of much help, though we try our best to help those through, you know, simpler techniques, or, you know, telling them by taking medication and using their fertility window and so on. For the other class, it's easier for them, for the educated lot of people. It is much more easier for me to communicate because they already know about their problem. So what brings them to us, any sort of patient, is that they are trying to conceive and get pregnant. And it's been over a year that they're married, but they have not been able to conceive. So subfertility is their primary complaint, which brings them to my clinic.
So what do you think, I mean, in your experience, how many years pass by after which people start thinking like, okay, we might have a problem and we need to see the doctor? Because with me at my clinic, so we have this diet design, we have the weight loss center and everything. So when people come to us, they have to fill out this like a very lengthy form which asks them about their mental health, about their physiological health. And in that, sometimes it comes across that, you know, they have been struggling with conception, and also that's a big risk factor for them. And it gives them so much stress. And I think the entire hormonal cycle gets disturbed, and it further delays the pregnancy. So, what do you think is a good number of years after which people should get worried about, getting pregnant?
So again, two categories of people. The general public, as I was talking about, the class that has social pressures. So if you do not give them the good news in
Right.
1 year's time, they're pressurized socially by relatives, by their in-laws, unfortunately. That brings them to us. Second group is the one who get married and they don't want to conceive for a few years. So it's the age of the female, and their history, as I mentioned before. And now they want to conceive and they have been trying to conceive, have not been able to do so. This is what brings them.
I wanted to ask you कि कितने early ये जो लोग contraceptive methods use करते हैं, once they get married, they don't want to conceive for a couple of years. तो उससे कोई नुकसान होता है उनको, like during for conception later on? Is it like something that deters pregnancy later on?
आप ये देखें कि जो हम ओरल कॉन्ट्रासेप्टिव्स देते हैं वो एक्चुअली हार्मोन्स हैं, होते लो डोजेस के अंदर है, बट होता ये है कि आपको रेगुलरली अपना चेकअप कराना चाहिए. इन माय ओपिनियन अपनी लैब्स करानी चाहिए फॉर एनी ऑल्टरेशन. यू शुड सी द पैटर्न ऑफ योर मेंस्ट्रुअल साइकिल. कोई इरेगुलरिटी तो नहीं आ गई. कब निकलवाना है आपने अपनी जो IUD रखी है या इंट्रायूट्राइन डिवाइस अगर आपने एज एन OCP रखवाई हुई है, कब आपको खत्म करना है. ये बहुत जरूरी है कि आपने फर्टिलिटी कंसल्टेंट को आप लूप के अंदर रखें या अपने ऑब्स्टेट्रिक्स गायनेकोलॉजिस्ट को.
So basically people should not take their decisions themselves and always consult a doctor, because I know so many groups and all these WhatsApp groups and on social media where people are giving each other advice and they're just following it blindly.
So trust me, it's not people giving advice. I receive so many patients who Google, they self-induce, they grow their follicles and they come to me without having. देखें, सबसे important जो मेरी practice में मैं as a reproductive endocrinologist या as a fertility consultant is कि आप you should start पहली step, one step at a time.
Right.
जो problem मैंने पाकिस्तान में देखी वो ये है कि आप वो basic parameters को evaluate नहीं करते. You do not find out the root cause. What actually is the root cause? Is it the male factor? Is it the female factor? Unfortunately ये एक myth रहा है बहुत साल कि जी infertility सिर्फ female के अंदर होती है. ऐसे नहीं होता. My prime super specialty is male infertility. So I work a lot on altered sperm parameters. Trust me, if I see 20 patients, 18 out of them, if I'm not exaggerating, would be having some alteration in their reproductive potential or altered sperm parameters. So the first aim is कि आप उनकी एक अच्छी सी history लें, उनकी evaluation करें through ultrasonography. If we come to the male, उसके semen analysis से, उसकी hormonal profile, female की fallopian tubes, the tubes that are connecting the ovaries to the uterus and help in the passage of the oocyte from the ovary to the uterus. And if that is the fertility window, and the female is married in our culture and she mates with her husband, if it's the click or the right receptive time, the patient would be pregnant. So unfortunately, the physicians and the patients themselves, without having a thorough evaluation, would just self-induce, grow their follicles and keep on inducing themselves that they would be pregnant.
That's unbelievable.
Yes, it is. This is what's happening and I'm encountering every day. So it's common sense कि अगर आपकी tubes खुली हैं, would only then it allow the passage of the sperm into the tube to meet the egg. If the tubes are blocked, there would be no passage of the sperm through it or the passage of the egg towards the uterus or the embryo अगर हो जाए. So blockage है तो वो दोनों, मैं हमेशा हंसती हूँ कि ये सोनी माहीवाल वाली बात हो गई कि वो उधर रह गया, वो उधर रह गया. Yes, that's the thing. So tubal status is so very important in evaluation of a subfertile female. Male parameters. आज तक पहले मेल्स कभी नहीं अपनी ट्रीटमेंट कराते थे.
Yes, absolutely.
This is very lucky and very fortunate कि अब आदमी को ये एहसास है कि there could be something wrong in me also.
That was also something, doctor, I wanted to talk to you about. कि बहुत मुश्किल है ये awareness या even males को ये बताना या suggest bhi karna.
Yes.
There could be a problem. Like
Yes.
people who come to me and they tell me that they have been suffering from infertility for the past 5 years. In the meanwhile, they gained a lot of weight. So I, refer them to an endocrinologist to
Yes.
check their hormones and everything. So वो बाद में पता चलता है cortisol levels ही बहुत high.
Yes.
It's the stress of not being able to conceive,
Yes.
which is causing the inconception, right?
Yes.
So it's like a cyclic issue.
Yes.
So अभी males के अंदर भी ये कुछ awareness आ गई. I remember one of my clients, they came to me, like they came for the female, like for her weight loss, and when they were sitting, तो वो ये बात कर रहे थे कि जी मैं तो बिल्कुल ठीक हूँ, इनको issues हैं. So I sent the male outside. I discussed it with the female, and she said कि बस ये है कि मेरे में कोई problem है जी, मुझे तो समझ नहीं आ रहा. Then I called the male and sent the female outside. I was like, now we need to talk. मुझे ये बताएं, देखिए आप किसी को भी मत बताएं if you're afraid of social pressures and taboos. So just go see a doctor by yourself. Don't even tell your wife. She doesn't need to know. लेकिन ये problem हो सकती है और ये लोगों को कोई भी बताए तो they don't like it, right?
Yes. और interestingly, जब हमारे पास पेशेंट्स आते हैं, फर्स्ट टाइम एक इवैल्यूएशन होती है, उसके बाद वो हमारी फैमिली बन जाते हैं.
Right.
We own our patients. We try to take the maximum good care of our patients. We like to connect with the husband and the wife with the problems they're encountering. So मेरी consultation is almost an hour to an hour and a half, and they are always welcome to come back with their questions or queries or problems wherever they need any help from myself or my team. So we are on board 24/7 for them. अच्छा, मजे की बात यह है कि the wife and the husband, they both have their own secrets to share.
Yes, exactly.
So, they come to me individually discussing their problems.
Yes.
तो उनकी बात हमें अमानत रखनी होती है.
Exactly. That's how we can help them.
Yes.
वो एक दूसरे को बताने का तो फायदा नहीं.
Yes.
That's exactly what I was saying. कि वो आते हैं अलग-अलग, फिर मैं उनसे मिलती हूँ, फिर मैं दोनों को अलग-अलग convince करती हूँ कि आप ये करें, अपने टेस्ट कराएं, go see a doctor. So I know that you have a very holistic approach towards this. So what other things do you, add to your assessment or your diagnosis or prognosis? How do you do it?
So you would find me different. So I strongly believe in lifestyle modification. One of the purpose of coming to you is this. I send you patients for this holistic approach as well.
Yes.
To me, it's just not the allopathic medicines. They are there. We are there to prescribe them. We do prescribe them. We treat them like they are. But lifestyle modification, so in my prescription, I find out the root cause. I ask them to do, if a patient is obese, would send to an endocrinologist. I would send them to you, a nutritionist and a dietitian. Then I would ask them to take antioxidants like, natural. दूसरे भी हम डालते हैं, जो हमारे supplements हैं, वो डालते हैं. Very basic folic acid, coenzyme Q10. Actually होता क्या है? DNA damage, epigenetic changes, behavioral disorders, lifestyle changes. This disrupts your hypothalamo-pituitary gonadal axis, both in the male and the female. मैं हमेशा अपने patients को कहती हूँ कि it's a ball game here.
Yeah.
Stress, I have to say it, but problems as in erectile dysfunction in the male, stress-induced work pressures, social pressures, husband and wife incompatibility, not having a child,
That's the biggest stress, that's what people are going through.
That's the biggest stress. So obese, the body shaming, like the body image.
Not liking themselves in their own body, that's like one of the biggest stressors of the females.
Yes, having hirsutism, facial hair, having thinning of the hair, having, a body image, जो obese है. So, there are multiple things, actually.
So your holistic approach, I like it a lot because I know you've sent me patients as well for their hormonal imbalances. So we have these supplements that we give them. एक हमारा है, it's called the hormone balance supplement, called Thermogen. It's a pink box which helps with hormone balance and also with obesity, and it also helps with conception. And then we also have the ashwagandha. वो आपको पता है ashwagandha is so good, we discussed about it last time we met.
Yes, and I work a lot on turmeric also. I request them. It's kind of funny because मेरी integrated C approach है. So I give them cocktails where we have antioxidants like folic acid, CoQ10, vitamin E, myo-inositol, L-carnitine, L-arginine. So वो हमारी वाली चीज है,
Yes.
you know, as a physician.
Yeah.
But then I tell them to do that seed cycling if
Yeah.
they're polycystic.
Mm.
I tell them to have primrose if there is premature ovarian insufficiency, or if there's diminished ovarian reserve. If the patient is about 35 years of age, so you tend to decrease the quality of the oocyte. Similarly for the male, if they are a chain smoker,
Yeah.
you know, if they sit a longer time, if they're exposed to pesticides, exposed to radiation, kind of occupational hazard, if they have the laptop in the lab for prolonged periods of time. So spermatogenesis or spermatozoa are very sensitive to temperature.
It's so difficult to explain this to people.
Yes.
Like I know people are driving and they put their cell phones in the middle of
Yes.
the seat and, you know, they're driving. So it's like, can you elaborate a little bit on
So
that?
cell phone radiation would alter the sperm motility, the count, the morphology. So it would create, you know, a hypoxic or a pro-inflammatory environment. In simple terms, मैं हमेशा अपने patients को कहती हूँ कि आपकी intratesticular सोजिश है. So it's a hypoxic box. तो आप खुद सोचें ना कि ऑक्सीजन डिफिशिएंसी होगी. So उस केस के अंदर जब आपको सांस नहीं आ रहा, तो everything would be, they would not be able to breathe, they would not be able to move, there would be sperm DNA fragmentation, they would, you know, be dead or immotile. So हम बहुत regularly, religiously, as a baseline parameter, have the semen analysis done and repetitive comparisons to see how our medication is improving. Then I have introduced very rejuvenating, innovative measures or techniques such as intratesticular PRP.
Okay.
I receive a lot of patients who are azoospermic.
That's something totally new.
Yes, that is so
exciting.
New. Yes, it is. It is very innovative. So I do it for both the male and the female.
Okay.
For the male, especially for those who are azoospermic or obstructive, वो दो तरह का होता है. It's non-obstructive and obstructive, and you know, it's through a specific strategy, ultrasonographic findings and hormonal analysis, you come to the conclusion कि ये कौन सी वाली category को belong. Is it reversible or is it not reversible? So we have those karyotypings, then we have the chromosomal deletions, there's Y chromosome microdeletion. We have a whole strategy for analyzing this. And those patients who have oligoesteno, and I find a lot of debris in the seminal plasma. Debris is an indication that there is lots of oxidative stress. So that is why I work primarily a lot on antioxidants. So the aim is to correct the baseline parameters and the physiological environment, along with lifestyle modification. If the patient is diabetic, we'll send to an endocrinologist. If the patient is obese, uski obesity ko kam karayenge. You know, chain smoker, quit smoking, alcohol abuse, anything, any precipitating factor, to wo cheez hum mana karte hain. Similarly for the female, and I've seen tremendous results. मेरे कुछ publications भी आ रहे हैं in the pipeline, especially for those in premature ovarian insufficiency or diminished ovarian reserve, or females of advanced maternal age जो 35 से ऊपर हैं, even in polycystic, because polycystic is a pro-inflammatory condition.
Yeah, I wanted to discuss more on that, because हमारे पास भी around 30% of the patients who are obese have PCOS.
Yes.
So can you elaborate more on that?
So if I see 10 patients, believe me, 8 out of them are polycystic.
Right.
हम उन खवातीन में जो even polycystic हैं या उनकी ovarian reserve कम है, जो हमने diagnose की through hormones, through ultrasound, hormonal analysis, हमने ultrasonographic findings, उसकी menstrual history, उसकी age देखकर, सबसे important उसकी age देखकर, हम उनके अंदर भी intrauterine PRPs करते हैं. फिर हम frozen embryo transfer करते हैं जब हम IVF कर रहे होते हैं. तो उसमें भी uterine receptivity के लिए we do a rapid flush PRP so that the uterus is receptive जब हम embryo transfer करें, and facilitates the uterine lining, facilitates the embryo to implant and continue with the pregnancy. जो आप पॉलीसिस्टिक की बात कर रहे हैं, आज से बहुत साल पहले शायद वो डायग्नोज ही नहीं होती थी. जब मेरे पास पेशेंट आता है मैं उसकी बात कर रही हूँ जो मोस्टली दिखने में आता है। वैसे लीन पॉलीसिस्टिक भी होते हैं, बट यूजुअली एक खास पिक्चर होती है, पेशेंट ओबीस है, सर के बाल कम है, मुंह के ऊपर बाल हैं, बहुत डिप्रेस्ड है, मेंस्ट्रुअल इरेगुलरिटी है और कंसीव नहीं कर पा रहा है, प्रेग्नेंट नहीं हो रहा है। सो फिर एक पूरी हमारी एक एसओपी है जिसको हम अबाइड करते हैं और फिर हम उसको डायग्नोज करते हैं पॉलीसिस्टिक के लिए। मैं अपने पेशेंट को हमेशा कहती हूँ कि आपका इलाज वेट लॉस के अंदर है, और अगर आप वजन कम कर लेंगे थ्रू होलिस्टिक अप्रोच, आवर मेडिसिन्स, लाइफस्टाइल मॉडिफिकेशन, हेल्दी ईटिंग बिहेवियर, तो आपकी मेंस्ट्रुअल इरेगुलरिटी ठीक हो जाएगी, आपकी इंसुलिन रेजिस्टेंस कम हो जाएगी, आपको शुगर नहीं होगी, यू वुड नॉट बी डायबिटिक, सर के बाल ठीक हो जाएंगे। यूजुअली पॉलीसिस्टिक में स्ट्रेस हार्मोन elevated होता है, thyroid hormones elevated होते हैं. So I've seen a lot of patients having high prolactin levels and hypothyroid. ये सब neighbors हैं. मैं हमेशा ऐसे करके बताती हूँ कि ये सब neighbors हैं.
That's so true. Yeah.
Yes. तो sometimes hormonal disturbance नहीं होता. कोई patients polycystic ovarian syndrome होते हैं कि वो manifest नहीं कर रहे होते, clinical manifestations नहीं होती. कुछ जिनमें hormonal disturbance है. I've just had done an IVF on a patient. बहुत प्यारी बच्ची, 26 years old, very lean, but polycystic ovarian disease. उसको clinical manifestation थी. She was so insulin resistant. वो anovulate करते हैं, वो ovulate नहीं कर सकते, इस वजह से pregnancy नहीं होती.
So for people who do not have this weight issue or obesity, how do they kind of understand कि हमें ये कराना चाहिए कोई test? Because I think it's also the menstrual irregularity.
Yes.
Okay.
It could be the menstrual irregularity, and once again coming to point zero, they've not been able to conceive actually. तो वो इस वजह से आपके पास आते हैं. Although हाँ बहुत सारी चीजें होती, maybe hirsutism हो उनको, could be menstrual irregularity, could not be menstrual irregularity. तो मे बी वो कभी अल्ट्रासाउंड करा लेते हो तो किसी ने बताया हो कि आपके जी अंडे छोटे छोटे हैं ओवरीज के अंदर. एक खास पैटर्न होता है which is called the pearl string appearance, तस्बीह के दानों के जैसे बहुत स्पेसिफिक पिक्चर होती है. You must remember that people have a genetic predisposition to polycystic ovarian. So ये चलता आता है in families. You are born with polycystic. Unless and until आपने ovulation induction ली है, you were not polycystic, but there have been those multiple follicular cyst development that gives you an image of a polycystic ovary. So lifestyle modification again, आपके पास भेजने का मकसद ये होता है कि हम तो ओरल कॉन्ट्रासेप्टिव्स अगर ज़रूरत है ट्रीट कर रहे हैं, हम हार्मोन्स दे रहे हैं अगर ज़रूरत है, हम और चीज़ें दे रहे हैं अगर ज़रूरत है, उसके साथ हम सप्लीमेंट्स दे रहे हैं, मायोनोसिटोल दे रहे हैं, ग्लूकोफेट दे रहे हैं, विटामिन डी, प्रोबायोटिक्स, न्यूट्रास्यूटिकल्स, अपनी मेडिसिन्स. बट dietary restriction and weight loss is the key to regularize their menstrual cycle and so that they are able to conceive. अपनी fertility. फिर सबसे important है अगर menstrual irregularity है तो उनकी fertility window भी move करती जाती है. So ये नहीं कि अगर 28 days का cycle है हम फिर उनको guide करते हैं, एक app का बताते हैं कि आप इस पे अपनी menstrual cycle को monitor करें, आपको help मिलेगी fertility window का, तो आप अपने उस time को भी utilize करें. So it's not just that कि एक ये myth है कि जी हर infertility का ट्रीटमेंट IVF ही है, ऐसा हरगिज नहीं है. हमारे बहुत सारे पेशेंट्स पिछले हफ्ते में माशाल्लाह 4 conceptions positive pregnancies हैं. Yes, by just treating their baseline parameters, bringing their internal environment.
This is without IVF.
This is without IVF. This is the beauty of our practice, that without, not everybody is a candidate of IVF. Yes, there are spot on people where I know के blocked tubes है, you know, diminished ovarian reserve है, severe male factor infertility है. So spot on पता होता है कि ये IVF का केस है, इसमें हम दूसरी तरह से help नहीं कर सकते. But the ones who have unexplained infertility are a young couple और supposedly कोई ऐसी abnormality नहीं नजर आ रही, the parameters are normal. उस केस में हम lifestyle modification, put them on antioxidants, wait and watch and monitor them, and they conceive.
Wow, mashallah.
Yeah.
अच्छा डॉक्टर ये बताइए कि for in your practice, for example, in a month, how many clients do you get, and what are the success rate? What is the success rate?
So we have a very specific clientele. I am open to everyone, but I enjoy working with those who understand the idea
जी.
of what's going on.
Basic awareness होनी
Yes,
चाहिए.
basic awareness. वो मेरे लिए थोड़ा सा मुश्किल
Easy.
भी होता है to make the ones understand.
हाँ.
उनके अपना एक vision होता है. You know, आप किसी को उसके vision से या idea से
नहीं
हटा
हटा
नहीं
सकते.
convince. But yes, अल्हम्दुलिल्लाह हमारा जो patient आता है वो convince भी होता है, वो हमारे साथ cooperate भी करता है. They become like a family to us, you know. और हमारे लिए ये success है अगर उनके हाथ में baby होगा, हमें babies मिलने आते हैं.
Yeah,
Yes.
that is, I think, the most rewarding thing,
Yes,
right?
it
कि
is.
जब baby हो जाता है and then they bring the baby to you.
Yes.
एक हमारा भी ऐसा केस था, but they were in Islamabad, so they were unable to conceive for 5 years. So the lady came to us for weight loss, but हमने जब वही सारी बात हुई, said, so you have a lot of stress and all. So we gave them our Ashwa Gold, जो हमारा herbal supplement है, and after a year, so then we kept a follow up. They were in Islamabad, they didn't hardly visit us. So follow up करते रहे. Then she told me, okay, I have conceived. I said, okay, don't come to meet me. Don't go anywhere. Like you've had this after 5 years. तो इसका ख्याल रखो और relax करो. And after a year, they brought the baby to Lahore. They came specially to meet me. And I was like really teary eyed. कि मुझे फिर उसके बाद से there have been many cases where that's how we actually I mean, that was the first time we actually realized कि ये वाले supplements कितने effective.
Yes.
बनाए तो हुए, लोग ले भी रहे.
Yes.
But those people were the first ones who took them properly.
Yes.
The male and the female both took the supplements, and it was so rewarding to see कि यार इनका अब एक baby है जो 5 years से नहीं था, and they were like super. They were over the moon about it. So I'm sure you experienced this a lot.
I do, and they listen to us like babies.
हाँ.
I must tell you. और एक चीज मैं बताना भूल गई कि अगर हम treat कर रहे हैं even unexplained infertility है, if the fallopian tubes are open and the sperm parameters are according to the World Health Organization standards, तो हम basic procedures like intrauterine insemination भी करते हैं where we get the best rapid progressive fast moving spermatozoa. We take out the debris, we prepare the sperm, we induce the ovaries, you know, the female to have at least a minimum of 2 dominant follicles greater than 18 mm, and then inseminate and then wait after 2 weeks pregnancy ho jaye to theek hai. So we can give up to 6, 7 or 8 cycles of IUI if the patient wants to decide कि अब 5-6 cycle हो गए and you know still the pregnancy negative है तो नहीं हो रही तो फिर हम
they take a break also.
Yes, they do. We give them a break or we switch them to IVF as indicated and in consent with the couple.
Wow, that's so good to know.
Yeah.
And this was such an educational kind of session. It was so informative. I think हमारे सभी जो viewers होंगे, they will benefit a lot from this. So everybody doesn't need treatment for fertility, but if you have any kind of hormonal issues या कोई भी endocrine problems है, कोई भी reproductive issues हैं, and then even after you're like a certain age and you have your kids and then you're going into your perimenopause and your menopausal stages, all those stages also require a lot of intervention from the right doctor.
Yes, from the right doctor, and we receive very challenging cases जैसे Klinefelter's है, जैसे Turner's है, जैसे Sertoli-Salonli syndrome होता है males में. So you know there may be pockets of spermatogenesis. हम उन patients को बहुत ज़्यादा help करते हैं. Sperm banking, oocyte banking, जिनको cancer diagnosed होता है, and you know breast cancer patients who want to have a family later, or males with testicular cancers or any blood cancers. So हमारा पूरा एक Oncofertility unit है. We have a cryo bank जहाँ पे हम patients diagnosed with cancer prior to chemotherapy or prior to cancer treatment वो आकर अपने samples हमारे पास freeze करा सकते हैं. That is my aim, to support you know this population of patients so that they benefit from assisted reproductive health later once खैर से वो ठीक हो जाते हैं and they want to start off a family.
Wow, that is amazing. It is so high tech.
Yes, it is very high
अच्छा
tech.
कई बार आप सोचते हो कि पाकिस्तान में यार ऐसी कोई चीज नहीं है, you know, आगे कुछ बीमार हो जाएंगे. आपने कोई stem cells अभी basically people
Yes.
know a little bit about that.
Yes.
But then cryogenesis with your ovum and eggs and all, I mean, that's amazing.
It is amazing, and unfortunately, कोई ये मानता नहीं. But regarding the infertility setups, I think we have international standards.
जी.
My practice, my lab does not compromise on quality. The lab quality, our success rates, वही हैं जो international standards पे. Considering the female's age, male factor, female factor, ovarian reserve, जितने parameters taken into account, success rate उसी से होता है.
Excellent. Dr. Arozia, thank you so much. And my last question too would be about menopause. So if somebody is going through a perimenopause or menopausal stages, will you be able to help them as well?
Yes, I would help them, and I do help. If anybody comes in menopause or postmenopausal, तो more of an OBGYN workup, but हम उनके PRP sessions करते हैं. Many of my patients have felt a rejuvenation in their overall health actually. Then we send them to you for the holistic approach as well. Then depends कि वो further कैसे चलना चाहते हैं. Evening primrose देते हैं, vitamin E देते हैं, just for their mental health. Then
So doctor, what kind of test do you recommend? जिन लोगों को menopause हो रहा है, they're not sure. They sometimes think that we're just skipping periods. Sometimes they think they're pregnant. Sometimes they think it's just because of stress.
yes.
So what kind of tests do they need to
So
get
if
done?
they come with irregularity, बहुत लोग आते हैं कि जी periods skip हो रहे हैं या महीने में 2 दफा हो गए हैं, 3 months में नहीं आए. So basically 2 टेस्ट होते हैं. Anti-Mullerian hormone जो आपको ovarian reserve बताता है, and follicle stimulating hormone. So if follicle stimulating hormone is increased, AMHs, they have an inverse relationship that is decreased, but you need to have them at 2 specific periods, 2 times, ताकि आपके पास comparison हो. Then you have an ultrasound. उससे हमें radiologist या ultrasonographer बता देते हैं कि ovarian reserve कितनी है. उससे भी आपको अंदाजा हो जाता है कि इनके पास कितने follicles are sitting in the ovaries.
Because so many people come to me at that stage, like 45 plus, के जो लोग मेरे पास आ रहे हैं with unexplained weight gain, unexplained hormonal imbalance, तो फिर उनको ये वाले टेस्ट सजेस्ट
Yes,
करेंगे.
and then it's controversial कि hormone replacement therapy लेनी चाहिए कि नहीं लेनी चाहिए. But
What is your opinion about it?
So
very controversial.
yes, it's very controversial.
Yeah.
If you have a uterus, तो और है HRT. If you don't have a uterus, तो HRT regime different है. Well, my opinion is to have a lifestyle modification, be on supplements, weight training करें, build up your muscles, lose your fat, deep breathing exercises, go for yoga, for Pilates, a healthy lifestyle, de-stress yourself, have, मैं खुद भी ये करती हूँ.
Yeah, I know we were talking about it that day कि अब ये hormone replacement therapy first step नहीं होना चाहिए.
No.
You just try everything else and when nothing else works, then maybe one can go
then
for
maybe
it.
yes, we can consult an OBGYN for HRT therapy. But मैं खुद भी ये करती हूँ and I feel much better. I exercise.
It helps so much.
Yes, I do. There is no compromise on this part of my.
It's a natural
health.
thing in the body. Once you work out, once you take care of your dietary needs, then everything falls in place.
And dietary help is very important.
Yeah.
Dietary recommendation उसके बगैर बहुत
कुछ भी नहीं चलता.
Yes, कुछ भी नहीं होता. Yes.
Thank you so much, doctor. It was so enlightening to have you here. It was so good. I think a lot of people are going to benefit a lot from today's session. I'm so glad you could make it today.
Thank you so much once again for giving me this opportunity. I actually enjoyed a lot, and anybody and everybody is welcome for consultation. We are always
We
there
will
to
be
help.
sending you a lot of patients.
Absolutely. Integrated Fertility Center is always there to help.
Thank you so much, doctor.
So much.
Thank you so much for watching, guys, and see you again. Bye-bye.